Nice to talk with you.
Thank you.
So, could you please introduce a little bit about your background?
Well, I have a clinic in Australia.
Yes.
And about 5 years ago I got my diploma in remedial massage. And I have done postgraduate studies in Western training in cupping, traditional moxibustion, and some other fields of Western massage. And last year I wrote an email to you.
Yes.
Requesting for some information about the treatment of a patient, which you readily wrote back to me and gave me some very good advice. And at that time you invited me to come to China.
Yeah. Okay. And what did you learn here during this 2 and 3 months program you stayed here?
When I first came to China to study at your hospital, the reason I actually came was because it was not just a school or a university, it was a hospital where the students got taught by the doctors who were treating patients, and I thought this would give more benefit to my training and learning than just being in a school. So when I got here, I was going to learn cupping and moxibustion, and my first teacher suggested that I read some of the basic theory of TCM. And when I did this, I found there was a lot more to learn about the medicine of even cupping and moxibustion and the many diseases that affect many people around the world. And the more information that I read, the more intrigued I became. And then I developed a whole new passion to learn a lot more of the traditional Chinese medicine. So then I asked to stay longer, and I decided I would learn the diagnostics, the basic theory, understand acupuncture and its application, learn the meridians, as well as some other of the topics, the 14 books that we study from.
Okay, so in my personal opinion, so this study program, this is very tight and a huge burden for the Western mind, yes?
If I was many years younger,
yeah,
perhaps a bit different. But I think the passion that one develops when they want to learn something helps you to learn. But it's been a very arduous and tormenting time at times, but it's been very pleasurable, and there's been a lot of knowledge to gain, and that has been because of the one-on-one teaching and being able to watch the doctors who teach us treat the patients and explain this, and then go back to the classroom and read and study these diseases and understand more about the theory and the history of TCM. And I think that is a very big, important matter.
So, Mr. Anthony, how about the teaching service of our doctors and staff, translators?
Very good. As I've already discussed, I've been very fortunate to have one-on-one teaching, and this time with the doctor and teacher in one has given me a lot of knowledge and helped me to learn a great more than I think I would have perhaps learned in a normal classroom, in a normal situation.
Okay, thank you. And also, what is the most impressive things that you witness here during your stay?
Since I have been here, I have seen people come to the hospital with chronic disease, and in the Western world there's a lot of diseases that are treated very differently to traditional Chinese medicine. And so I've been able to witness and watch people progress from a very debilitating state of health to improve their health. And I've been able to talk to them about their treatments and learn how wonderful the TCM is. And I believe that TCM can help many more people in the world than perhaps Western medicine can today. And this is why I've wanted to learn TCM. And to see it has been very fortunate for me to be in this position to learn.
Okay, thank you very much. And also, so do you have some suggestions about how to widen our service of the international teaching program? Is there any good ideas?
I think as the hospital grows, because it's just new, it will provide a lot more for the students. My advice to other people coming to learn TCM would be to perhaps get a couple of the basic books first, to read through them prior, and to have a little bit of insight to the TCM, but also it will give them questions, because it took me a few weeks to read the books to develop the questions that I needed to start thinking, and to start thinking more traditional medicine rather than Western medicine. So I think one of the key facts is to remember that this is learning about the history of Chinese medicine for thousands of years, not just Western medicine for the last 100 years.
Oh, thank you. So you mean when the students come, they should have some basic knowledge so that the study program here is more progressing, right?
I think if they read the basic theory and the diagnostics book, it will give them questions that they will be interested in asking the doctors when they first get here, and will give them some small insight to what TCM is about.
Okay, so you mean after you stay here for 3 months, that your ideas is more and more Chinese type, right?
Oh, definitely, yes.
Okay.
Sometimes it's been very hard to forget the Western medicine to understand the Chinese theory, but the more you do this, the more you can understand how it works. And there's a great history involved behind TCM, so this is why it's not something very simple to learn, but very interesting and worthwhile.
So thank you very much.
Thank you very much.
Thanks for all your...
It's been a pleasure.
Yes, okay. So this is the certificate, one of the certificate you should sign. Okay. Okay, congratulations.
Thank you very kindly.
So I hope not only Chinese medicine study program, and also your profession study program will be very successful, and you combine all the knowledge together so that you will offer a better service for your clients.
Oh, I will, and I'll be coming back hopefully next year to learn some more.
Yes,
because when I go away I will have many books to read that I've brought. So thank you very much for the opportunity.
Okay, thank you very much.
Again, thank you.
Yes. Okay.
Le digo que no es un gusto local, playera.
نار صيني
الثاني يوم
نار صيني
ثاني
ده
1100
نار صورة وقت تصوير
إذا بدك وقف
من 300 سنة عشان السيلفر هاي يا بط 10 ين 10 ين
Please look at me.
very expensive.
على إمران.
Fish.
No animal vegetarian.
تعالوا يا هوني تعالوا تعالوا
Huh?
The purple grass.
Toilet.
No, it's green. And then it has awful.
Hi Hitler. How are you?
Tell me you love me, then let me die.